Hi, my name's Allison Clayton, and I specialize in helping Medicare beneficiaries like you with their healthcare decisions. Medicare guidelines and all the information out there can be sometimes a bit confusing. My goal is to help make Medicare easy to understand. So I put together these Medicare Minute series of videos with the Medicare basics and the most frequent questions that I get from my clients, and then the short answers to those questions. I've been helping Medicare beneficiaries for over 8 years, and a lot of people out there have the same questions for me. So I hope these videos help shed some light on your questions about Medicare and how it all works. I hope you enjoy my educational series. What is Medicare and who's eligible? Medicare is health insurance for people 65 or older, certain people under 65 with disabilities, and people of any age with end-stage renal disease. Medicare is administered by the Center for Medicare and Medicaid Services, or CMS. You'll be automatically enrolled into Medicare if you are already receiving your Social Security benefits or a railroader's retirement benefits. Others must enroll themselves through Social Security. When you're enrolled in Medicare, you'll get your red, white, and blue card in the mail. If you're automatically enrolled, you'll get your red, white, and blue card in the mail 3 months before your 65th birthday or your 25th month of getting disability benefits. Original Medicare, Parts A and B. Original Medicare, what is it? When you hear the term Original Medicare, this is referring to Part A, hospital insurance, and Part B, your medical insurance. Original Medicare is managed by the Centers for Medicare and Medicaid Services. Social Security works with them by enrolling people into Medicare. Original Medicare, Parts A and B. Part A, in general, Part A covers inpatient hospital, skilled nursing facility, home health care, and hospice. You usually don't pay a monthly premium for Medicare Part A hospital insurance if you or your spouse paid Medicare taxes for a certain amount of time while working. This is sometimes called premium-free Part A. There are deductibles and copays associated with Part A. For example, at the hospital, you may be responsible for a deductible, so please refer to Medicare.gov or call 1-800-MEDICARE to find out what the current costs are for Part A. Original Medicare, Parts A and B. Part B. Medicare Part B helps pay for care you receive in a clinic or hospital as an outpatient. Part B also covers most doctor services you receive at a hospital inpatient. Most other hospital services, like I mentioned before, are covered by Part A. Medicare Part B covers doctor's visits and most routine and emergency medical services, and it also covers some preventative care like flu shots. You pay a premium each month for Part B. Your Part B premium will be automatically deducted if you get benefits from Social Security or railroader's retirement. Others will receive a quarterly bill. And some are eligible for the state Medicare savings programs, which may help pay for Part B premiums and more. There are deductibles and coinsurance associated with Part B. For example, at the doctor's office, you may be responsible for a coinsurance of 20%. Please again refer to Medicare.gov or 1-800-MEDICARE to find out the current costs for your Part B Medicare. What is Part C? Part C is also called Medicare Advantage, which is an optional form of coverage where you can get all of your Medicare Part A and Part B coverage. This is not part of Original Medicare, so you do not enroll in this at the Social Security office. Medicare Advantage plans are offered by private insurance companies approved by Medicare each year. You must be enrolled in both Part A and Part B to join a Medicare Advantage plan. You'll still be in the Medicare program, but you'll receive all of your benefits through the plan instead of through Original Medicare directly. Medicare Advantage Part C plans combine coverage for hospital care, doctor's visits, and other medical services all in one plan. So these plans are required to provide all the benefits offered by Medicare Part A and B. And many plans also provide prescription drug coverage and additional benefits like your routine dental and vision care and gym memberships. Parts of Medicare Part D. What is Part D? Part D is prescription drug coverage. Original Medicare Parts A and B does not cover prescription drugs. Many people who choose Original Medicare add a standalone prescription drug plan or choose a Medicare Advantage plan that includes the Part D. The Part D plans are required to cover certain common types of drugs, but each plan may choose different drugs that it covers. The drugs that you take may not be covered by each plan. You need to review each plan's formulary, Formulary is a list of prescription drugs that are covered by a specific plan to see if your drugs are covered. Part D is optional, and not everyone may need it. So, for example, you might be eligible to get your prescriptions filled at the VA. However, if you do not enroll in Part D when you first become eligible and you decide to enroll later, you may be subject to the Part D enrollment penalty and may pay this penalty for as long as you have a prescription drug plan. In general, you may enroll in Part D if you are entitled to Medicare Parts A or if you're enrolled in Medicare Parts B. In addition, you must live in the service area of a Part D plan. And finally, if you enjoyed this video, be sure to hit the like button, share with your friends, and subscribe to my channel for more information about Medicare.